What's up, you guys? This is Bo Miguel giving you your daily dose of radiation. Today's video, we're covering some tips and tricks to quickly notice as an X-ray tech how broken the patient's body part or how much in pain the patient is, depending on what you see visually before you actually even take the image. So this knowledge, I'm an X-ray tech, been doing it for 4 years, work typically night shift, 7 on, 7 off. Work a lot of day shifts, so I do dabble in the day shift crew. So majority of this knowledge, if you're new to the X-ray world, you can acquire majority of this knowledge from someone who's been veteran, probably even in a few months, especially if someone's been in the game 10, 15 years. They can easily spot out some of the knowledge I'm about to give you. This is mainly for the new peeps out there or for some of the students, so you can be a better X-ray tech and, think smarter and work not as hard to get certain stuff. So one of the most easiest ones to tell is for a hip, okay? So most likely, if you're gonna have the cross table, as soon as the patient in, you quickly look at their feet. There's two things you can typically see. If both of their legs are fully stretched out and one of them is like completely all the way to the side, majority of the times the patient's leg is either broken or something going on, like really bad. Two, one of the foot is, or the leg is like there's a good difference in extension. That one is another sign you can quickly tell that it's gonna be good. Like the patient's most likely the leg's gonna be broken. For like shoulders, if their shoulder is positioned depending on, I guess, if they fall or break or whatever, usually majority of the times what I've noticed is because like if they fall and they're in a sling, they already have their sling, okay? If they're not able to usually supinate their arms or even move, and all you can get from them is like this, and then like this is all you can do. Most likely the humerus head is probably broken or dislocated. Those are kind of what you typically see. If they can't, which once again, there's different ways you can perform those exams, which we can learn in another video, but I'm just giving you some simple things to tell. So what other one can you see? For like the forearm, usually we do the forearm, you want them to be AP, so supinated, arm extended out. If the patient can't rotate their arm at all and you can only shoot at PA, most likely either it's the wrist that's broken or the middle of the forearm that's broken. That's something you'll just have to document that the patient can't. And usually you don't have any, I haven't gotten in trouble by any rads or even the doctors in the emergency room, because as quickly as they see it that something's broken, they're like, okay, well, that's probably the best you could until we do post-reduction or the ortho doc or whoever is going to work on the first. That's another common one. Wrist, for wrists, that one's more kind of easy. So usually your wrist sits like this, pretty straight on. So usually either your forearm part or your hand part will be like shifted up or down a good amount, or it'll almost look like a little squiggly line. That you can quickly tell that's you're gonna have to do some manipulation of the tube or do some different shots to get the most optimal images. What other ones? Obviously, if the patient comes in and you see the bone sticking out, that's a no-brainer. That's not supposed to happen. An ankle, I've seen an ankle where the person's ankle was his foot was upside down. That was the most wildest thing I've ever seen. One patient's foot was up and then the other one was the complete opposite, facing down. I didn't even, that one completely blew my mind. Because I was not prepared for that, and I was I ain't never had to do a reverse foot before, so that one we had to take many pictures, cross table both sides, shoot it both down and up. Like, we were going not conventional just to get the most amount of pictures so the rad could take a lot of notes. Like, some stuff, people will break their stuff, and it just mind blowing how, and then depending on what happens. For knees and femurs, I would say if it's like swollen at the knee and they can't really move their leg at all, sometimes it's caused by other problems, but sometimes just one little tiny spot will be chunky and swollen more towards the knee, or their lower femur will be broken. You can kind of see, and usually the patient will be sitting one way, hunched on the opposite side, to be positioned in a certain way where you can kind of tell oh, this is gonna be not the best picture. So with all those, most of the time you'll do cross tables. You'll probably have to angle the tube a certain way to compensate for an oblique if you can. And sometimes you'll have to hold and be wearing the lead. So all those are kind of some of the more basic signs that a patient is going to have something broken, and you'll have to kind of use your big boy brain to come up with those skills. And yeah, it's been your boy Miguel. See you on the next one.